Good morning, everyone. This is Larry Boris. I'm the Executive Director of the National Association of Worksite Health Centers. I want to thank you for joining us on this lovely day in May. This program is part of our ongoing series to help employers and unions and their partners to improve the value and operations of their on-site, near-site mobile virtual centers. Today's program is about the implementation stage of a new worksite center, or frankly, even if you're wanting to add a center to one that you currently have. The foundation for your center really starts here. The potential success and frankly, potential problems start here as well. If you don't do a good job in implementing a center right from the very beginning, if you don't plan as well as you should, these things will pop up and haunt you for many, many years. And you'll not be as successful as you want, or it won't meet your expectations. So we're very pleased to present this to you. So for those of you who are not familiar with the organization, NAWHC, the National Association of Worksite Health Centers, is a nonprofit organization focusing on helping employers, unions, and other sponsors of on-site, near-site mobile and virtual centers do a really great job in getting more value from their investment. We also invite and have as members all the health service providers, health providers, and others who help manage these centers for the employer and union sponsors. We try to assist people in their understanding of the marketplace and of what others are doing. We really focus on benchmarking and networking opportunities. Whenever on our website has a plethora of information and resources available for you. So we hope you'll take advantage and visit it. We have some programs coming up. We partner with 2 national conferences each year. The next one is coming up on June 23rd and 24th in Chicago, the 2022 On-Site Health Employee Summit. And then on July 18th and 19th in Boston, another national conference. Our own annual forum on creating and expanding worksite health centers will be September 8th and 9th in Nashville, Tennessee. We hope you all participate there. You can look at information on all these events on our website. And again, so please take advantage of looking there. For today's program, again, I want to thank our 2 main speakers, Leah Cathy, who's Premis's Executive Vice President of Operations, overseeing the implementations, operations, support, solution, and client services. She's responsible for development and deployment of programs to optimize member client operation team members' experience. Prior to Premise, she worked with Concentra and HCA. Penny Gilbert is a purchasing specialist supporting Textron Incorporated and its various business units, procurement of health, medical, well-being, benefits, and services. She's helped facilitate outsourcing of the on-site and occupational medical services and an implementation of the on-site health centers and pharmacies at 2 of Textron's business units. Previously, she was with Textron Aviation, responsible for their OC Health centers, pre-employment physicals, workers' comp, disability management, accommodations, well-being programs. And with that, I'll turn it over to Leah. And again, if you have questions, what we're going to plan on doing is we're going to take those all at the very end. I'll be going around to everyone who's listed as participating. And of course, if you're a participant, that means you must participate. I will be calling on you for questions and comments or sharing of any experience you might have at the very end. You're welcome to submit questions prior to that, and we'll respond to those all at the end. So with that, turn it over to Leah. Leah.
Great. Thank you so much, Larry. And good morning or good afternoon, depending on where you are all located. We are excited to be able to spend some time with you all talking about one of our favorite things is implementations. So before we get started, I wanted to give just a little bit of background. Penny and I met actually 4 years ago during her first implementation with Premise Health, and now we've just completed her third implementation with Premise as of this month, which I'm sure she'll have the opportunity to talk a little bit about as we go along. And each one of those was based on different needs for Textron. Of corporation. And I just so appreciate the relationship that Penny and I have. And as Larry mentioned earlier, he gave great bits of wisdom around how significant the implementation portion of the relationship is. It's really creating the foundation. And that's where our relationship started, and it's continued to grow and develop from there. So super excited to have this opportunity to spend some time talking about implementations with Penny. What we're going to do is we're going to really have a conversation about at the point where the employer has completed a formal process such as an RFP, or you may have gone through your own due diligence and research to really determine who is going to be the partner that is going to implement the health center and the services that are to be provided in the ongoing management. We're going to talk through both the vendor and the employer perspective of really what to expect when implementing an on-site health center. So we will go ahead and get started. So we're going to really dive right in of how do we get started. So we've, are happy that we've decided who that vendor is going to be. So there's some quick celebration, but now it's really time to roll up our sleeves and start doing the work that needs to be done. And so what do we need to do with our vendor? So for Premise and in probably most cases with other vendors, there's a couple of things that we really need in order to get started and to be able to dedicate resources to the implementation. The first thing that's a must is we've got to have alignment on the scope. So what are we going to be implementing? What services, what products, what the population is? Is it just for the health center, so the local population, or are there going to be virtual services, so a national population? So making sure that there is alignment on the scope of what we are implementing. The second thing is written approval of the budget. So typically there's going to be an implementation budget. Those things are going to include the FF&E, the furniture, fixture, and equipment, the installation, the cost of the installation for that equipment, the supplies that are needed for the on-site health center, the travel expenses, all of that's going to be included in the implementation budget. And then typically there is at least a year one of ongoing operations that's included. And so that needs to be approved by the powers that be from the employer so that we can get started. And then the third thing, which is always great to have, but in reality, 95% plus of the time, this is not executed yet, which is the contract. However, that does start and is being worked on concurrently along with the implementation and does need to be executed prior to go live of the on-site health center. So once we have at least two of those three things in place, what we want to spend a little bit of time on is gearing up for those key roles, both from the vendor perspective and the employer client perspective. So from the vendor, we have our project manager, which is really the primary point of contact for the implementation. They're developing the customized project plan and schedule based on the project needs. They're managing the overall communication regarding the implementation to all stakeholders or roles that are involved. And they're also escalating risk to the teams and working through developing an action plan if one is needed based on the risk that has been brought up. The implementation manager, they're really a subject matter expert and consultant for client and operations for the implementation. They're responsible for completing all of the tactical activities of an implementation. So all the ordering of equipment, the supplies, installation of the equipment into the health center, setting up the rooms as they should be, prior to go live. They're setting up all the lab accounts and things like that, supporting and developing the training schedule for the staff that will be in place. And they're also doing this based on monitoring the implementation budget. For the director of client operations, they really own the client relationship from the time that the vendor has been given the award to move forward with the implementation. And so they are designated at the beginning of implementation, and they work through all the way post implementation and then manage the relationship and the ongoing, they oversee the ongoing operations post go live. Also for the IT implementation manager, they are a subject matter expert and consultant for all things related to the technology component of an implementation. So they are responsible for all the tactical pieces and activities related to IT, the coordination of the circuit install, which is a big piece of an implementation, is making sure that's done successfully. Ordering of IT equipment, the install of IT equipment and computers. And so the implementation manager, the IT implementation manager, and the director of client operations are very much on site, especially once the facility has been turned over to premise to start really inputting in all of the equipment and supplies and things like that, and the training for the staff. And then finally, we have our work stream department leaders. Within premise, we have up to 16 work streams that could be involved in an implementation. A lot of that is dependent upon the types of services and products that we are going to be implementing based on the employer's needs. But some really big key ones are going to be talent acquisition, revenue cycle management, the technology piece. So data record transfers is a big part and a work stream that's discussed. Contracting, legal, there's others such as member engagement is another important work stream. And so those department leaders are assigned to the implementation and really ensure that they are an active and engaged participant throughout the implementation, ensuring that they're meeting their deliverables and milestones from the project. Penny, I'll turn it over to you to give some high level on the employer roles.
Sure. So what I would recommend is this overall, when you're looking at a project team, you need to have somebody from all of these areas, which we'll briefly go down through, but then also kind of have a backup. This isn't just a 6-week project. This is the long game. And so the reality of developing conflicts or other conflicting priorities, vacations, people being sick, those types of things, you need to have some backup folks who are kept apprised of what's going on and participating as they can, but so that they could step in the event that maybe the lead person from these areas is temporarily unavailable. So don't be shy about assigning folks to the team and making sure that it's on their radar. Certainly your key decision maker, your sponsor, your champion. So typically senior leader certainly needs to be involved. They probably won't participate in the day-to-day, but there are times when you're needing to assess certain levels of risk. So for example, if you have a high deductible health plan with a health savings account, fair market value, deciding what you're going to charge for your encounter fees. There's an element of risk there because the IRS has very gray guidance on that. And so you need to keep them apprised along the way. And so something that we did that I found to bode very well for us was we had our implementation team that met externally with Premise, but we also met internally with the entire group, just a quick 30-minute meeting every 2 weeks. just to keep them apprised of what was going on, let them know what was coming down the pike. So we had a big kickoff meeting to kind of talk through, for example, we have a union. So, did we anticipate any issues or things that we might need to navigate or extra effort that we might need to put forth in that area? So certainly we had our labor relations person involved. On the information technology side, we called them all together, kind of laid out the grand plan, and had our own internal tracking sheet. So Primus has a very robust implementation spreadsheet that helps us with the timeline and things that we need to do. But we had our own as well for our own internal items that need to get taken care of. Certainly meeting with that project sponsor every couple of weeks and the rest of the team, project manager and lead. There is a lot to an implementation. There's a lot of moving parts and pieces. So you might even want to entertain having co-leads because there's a lot to get done. But two people that tried and true are going to be there every time for every meeting as much as possible. I would recommend and have some authority. So it's going to depend upon your culture within your company, but hopefully that project manager or lead can make a lot of the decisions and perhaps maybe just some of the riskier ones you might have to elevate. Certainly human resources and benefits. You're going to have to get plugged into your insurance companies where that's a third-party administrator if you're self-insured, obtaining the claims data. Our friends in the insurance business are always fun to deal with and sometimes have different competing priorities. And so it's not just a quick phone call. Hey, we need our last 2 years of claims data. Can you send that on over? So those are long poles in the tent from my experience. That takes several weeks, if not months, to get that information over to your vendor to help set up your clinic for success. Eligibility files. Those also take a lot of time as well. You might have a privacy officer that you need to consult with, get their approval of what information is being transferred. You might need to do some IT risk assessments to make sure that whoever you're transferring the data to, that your company is comfortable with the security and safety of their IT systems. It's personal, private information. We want to make sure that it's protected well. If you have an occupational element to it, certainly you're going to need to get your friends from environmental health and safety involved to make sure that all their needs are going to be met from the occupational side. Certainly IT, Leah touched on that. I touched on it with the claims data, but even as something as simple as your phone system, right? If you've got 32 different phones in the health center, you're going to need to get those programmed appropriately. So collaborating on that. Security. You need to take a look at the security of your facility. In our instance, both of the business units that I dealt with, not only are they in aircraft and have backup to runways, airports, military bases, or military runways. You have to take a look at all of that and access to the location that you might select. And you need to get your friends in marketing and communications involved from the very beginning. Healthcare is very complicated. And if you're choosing to have an on-site health center, you're choosing to disrupt the system and you're going to be doing something different. And that takes a lot of education and a lot of dripping on your employees on why they need to use that health center, why it's in their best interest to use that health center. You're making a huge investment in your employees. It's not a field of dreams. You build it and they will come. You're going to have to put in a lot of FaceTime with your employees and just blanketing and repeating a lot of communications to get them to have that paradigm shift, to recognize that this is not like a pharmacy that you see in the community. This is not like your primary care physician that you go to. And then certainly, I'm willing to bet that most of you don't have a health center or a facility that resembles anything close to a health center on your grounds. So whether it's remodeling a particular building that is surplus at the time for you, or that you've decided to make space for the health center, or a brand new build, you're going to be tied to the hip with your facilities folks, building the structure and getting things ready to go for the on-site health center.
So we're going to sit here for just a little bit and walk through the implementation process overview between vendor, what vendor is focused on, and then of course what the employer is focused on. So from a Discover perspective, this is really our time to understand the health and wellness vision for the employer. We're also wanting to know who are all the partners that are going to need to be involved related to a benefit plan design. So who is the health plan? Are there other third parties that are involved as far as who manages the eligibility file? Is there a third party that manages the eligibility file? So we will want to work to get all of that information during our discovery time. We'll also want to know, has space already been identified? Is there design support needed? One of the other roles that specifically Premise has is an architect that is full-time with Premise Health and sits within the implementation team. And Penny, I know that you've had experience with our architect, Doug, who is a wonderful resource for our employers and clients to be able to use if they need that design and layout support, because he certainly is an expert and has the needs that are going to be provided, the services that will be provided in the health center in mind for what and how it needs to be designed. We'll also do a formal site assessment. So if a site has been identified, but there is build out that needs to be done, we're still going to want to go on site. And we'll talk a little bit later. I'm sure Penny will has a lot of experience of going through, the type of location that is being chosen and what that looks like from an access standpoint. We certainly will do a very formal deep dive assessment if there is a lift out, which that is, a situation of a lift out is where there is currently a vendor in place providing services. There are lots of unknowns that are uncovered during a site assessment that are very key in needing to know that information when creating that project plan. So we're trying to figure out all of those details during the discovery process, knowing that if there is a build out, it typically takes 180 business days. So it's closer to 9 months when you're adding in the weekends for a build out, looking at, all of the aspects of the location. And, if there is security that's involved, or if it's in front of security or behind security. So we're trying to work through all of those details so that we can get to the plan phase. Really the long poles in the tent that we work with is the construction piece, the talent piece, especially for medical providers, physicians, PAs and nurse practitioners, the IT install, the circuit installation, and then the eligibility file can at times be a long pole in the tent where we need employer stakeholders to be aligned with what information is going to be provided on that eligibility file. The data on the file is pretty significant when we're trying to identify members that are going to be using the health center, and also from a reporting perspective as well. So those are the 4 tents or 4 poles in the tent that are usually identified throughout an implementation. Penny, anything else you'd like to add on the discovery piece?
Yeah, so when you're selecting your location, you're wanting dependents to utilize it. So something that is easily accessible for them, easy to find. One of our business units has a very large campus. And so we selected a building that was near a main entrance that hopefully from the road, you can see the sign over the building. But also when you're selecting to, I would encourage you to look at potential future growth. So, our first on-site health center that we did, they not only outgrew their space very quickly, their kind of landlocked, if you will, and they're wanting to expand and add a couple other services, and they're struggling on where they can put it to where it's co-located in a logical space with the existing on-site health center. Our one that we just opened here in May, however, that's, one of the first questions that we explored with our facilities folks is, okay, so, initially we're going to have this little corner of the building, but, do we have the opportunity to expand out on the first floor? It happens to be a 2-story building. Can we expand up and talk through that with them so that we could not be landlocked, be faced with perhaps relocating it after it's been established. So certainly want to take a look at that. Building ownership. So again, one of the health centers that we did, the business unit actually owns the building. The other one, it's a leased building. So that adds another layer of complexity to doing the subleases because you have to have another party that you're dealing with relative to that. So and then again, I mentioned earlier, it's important to have security involved, depending upon the structure that you have for your facility. So we had to, like I mentioned, we back up to runways. And so we had to put alarms on our doors, and we had to have them badge restricted and those types of things to make sure that once outside dependents or even employees that didn't belong outside the health center couldn't exit out some side door or some back door.
Well, yeah, a quick question for you. Penny made an excellent point about planning for the future. What percent of premise clients end up expanding beyond their initial location, would you say?
It's high. I would say close to like 95% expand their services once they've implemented the on-site health center.
So how do you anticipate that during the planning stage?
Yeah, I think that's a great call out. And, we talk about that during the discovery piece, especially when and if there's already space that's been identified. And, in Penny's situation with her last implementation, there was a good amount of space and an opportunity to plan for the future, as Penny just mentioned, with potential other services that may meet the need of the population. So we encourage that in conversations when thinking about locking in within some space. If there's an opportunity to expand, what's behind that current space where we could expand for more services. The other thing too is now we have the virtual digital component, so which doesn't take up space, but can also have a greater reach with the employer's population, and that is something that many of our clients have moved forward with implementing is the virtual services from primary care, OC Health, behavioral health services, which is a great benefit because it isn't taking up additional space, but growing their access point and service delivery options.
Yeah,
thank you.
What I would add to that also, Larry, is that any vendor that you work with on this, they should have some good modeling. If they've been doing this a while and they can predict what your penetration is going to be based upon your population. In our instance, we, in terms of selecting a location, we did a heat map. We have several campuses all over the city. So we did a heat map of where our employees work and where they lived to try and make sure that the first clinic that we go in with is going to be in an area that is convenient for employees to use. So along those lines, you can take a look at and work with the vendor on the penetration rates. And we had a 5-year plan on what it's going to look like and how it's going to go and what would be logical next services to add so that you can try and plan for that.
Yep. So we'll move on to the plan phase of the implementation process. So, after discovery and we're identifying who those individuals are that are going to play those roles that we just reviewed from the employer and the vendor side, After site assessments have been completed, where you have alignment on if there's going to be a build out or if it's a lift out, we're customizing a project plan and creating that, including milestones and deliverables, and really setting expectations between both partners, the employer and the vendor, and discussing any possible risks based on timeline and what the appropriate strategies are going to be. One of the things that we talk about often when we're in the planning phase is when we have a request for a shorter timeline than what we are recommending. And that is certainly something that is discussed and is very transparent with what potential or possible risks there could be, and what are some of the alternatives to be able to still meet that short turnaround time, but with some concessions that need to happen. So, for example, depending on how short the turnaround time is, we may have to start on paper temporarily versus the EMR system because of the IT installation is something that takes longer. It's one of the longer poles in the tent. Or if we don't have the opportunity to have all staffing in place, we may have to use locum or staffing agency temporarily while we're getting the permanent staffing in place. We may have to limit services starting out, again, dependent upon some of the other pieces I mentioned earlier as far as IT and staffing. So those are some of the risks that we talk about, especially when it's a short turnaround or it's a lift out. As far as, what can the vendor or the employer rather expect to own as far as their responsibility, that's discussed during the planning phase. So if the employer does want to do a build out and is choosing to manage that project, the construction project, typically the employer owns, the facility build out, the utilities, the office furniture, because often it has a specific theme along with maybe their current design, the telephone, security services, things like that. Premise does have a facilities department where we can provide construction services. We do that for our Premise Health shared near sites, but more so than not, the client does choose to use their own facilities team or local construction to build out those services. Penny,
Yes.
any additional information?
So certainly in our case, we, had our own local architect, which you need, and facilities folks, as well as an interior designer, that certainly lent a lot to the build process and really helped us to think of a lot of different aspects. So, I mean, even having done an outsourcing of existing occupational medicine and then 2 on-site health centers, even with this last one, there were items that came up that I was like, wow, how did I miss that? I mean, I don't recall hearing that before now. I mean, there are so many levers that you have to pull and so many details that if you do have senior leadership that's wanting you to shorten the time frame, you need to definitely do your due diligence with the supplier, have them outline, here's what it's at risk. Here's the downstream effect of you shortening this from 180 days to 150 days. We did that. We did that in one of our implementations, and everything that Premise told us was going to happen happened. And so you want to make sure that if that's really the choice that your senior leadership is going to make, that you do your due diligence in explaining to them, okay, everybody's on board, we're going to do this, but here's the risk, and explain it from the beginning. So later on, when there are a few hiccups, it's not a matter of, I told you so. That's not a wise career move. You wouldn't want to say something like that. It's more a matter of, okay, we knew this might happen. Let's sit down and figure out how to adjust and make the best out of it. So Certainly the timelines, and that's something else that I would mention, with so many different levers that you have to pull, particularly if you have a relatively small implementation team on the employer side, is, ask the supplier, if they're saying, hey, we need a decision on the clinic name, and say, okay, we're planning on doing a few things here relative to coming up with a clinic name. What's our timeline? When do you need this by? So, unbeknownst to us, you have to have the name when you apply for the license for the health center, for the pharmacy. And so, naive me, I thought, well, that's something we can decide later on. No, that's really something you need to decide up front. Having the addresses is important as well. And so when the supplier is asking you and saying, we need this information, you don't be shy about asking, okay, when do you need it by? So that you can prioritize and make sure that you make the decisions timely. And if it's not realistic, then there again, you can educate the leaders and the champions of the project on, hey, they're needing this by next week. I see you're on vacation next week. And being able to communicate back to the supplier, I'm not even going to get on their calendar until 2 weeks from now. And what is the consequences of not making that decision until 2 weeks later, a month later, so on and so forth. So for example, our most recent clinic that we opened, we were wanting to do a naming contest. We were wanting to have the employees, offer up suggestions for it. And at the end of the day, we waited too long to act on that. And so we just had to name it. The timeline is important, and you need to listen to the people who've done this a few times to help you prioritize what you need to work on.
Leah, again, Penny raised a really interesting point about licensure. Typically, do worksite centers have to be licensed by the city, county, or state, or is that up to each state and municipality?
There's various licenses that need to be obtained, and it does depend on the services. Penny mentioned pharmacy. So with the last implementation, it was a pharmacy, and with the Board of Pharmacy, to receive that license from the Board of Pharmacy, you have to have, the very specific street address, suite number, if there is one, and the name of the pharmacy, or the name of the pharmacy. From other licensure perspective, it's to get various licensure to be able to do point of care lab testing, and other things like that are needed.
Great, thank you.
Also, your certificate of occupancy, and those types of things related to construction. You need to be able to identify the address, phone numbers, things like that. Okay. So now we will move into the execute phase of the process. And this is really where majority of the work for the project is completed, is during this phase. So we're working on executing on all the project deliverables and milestones according to the schedule. We're talking about risk and mitigation of those risks and what the strategies are real time. And quick decisions need to be made if those things do present themselves. The work streams I mentioned earlier are really getting involved at this time. RCM, the EMR build, talent, those types of things. Also during the execute phase is when there is a build out and the employer is managing that piece of the project. There's a facility possession date that we are very focused on that is a key milestone in the project. And this is the date in which Premise is able to come out on site and install things like IT. They're able to place the furniture, fixtures, and equipment where they belong. We will bring in the staff and start onboarding them and training them. This is a very important date where basically construction is complete. So generally certain things that are needed to have a successful facility turnover or meeting that possession date is that ceilings and walls are up and paint has been completed and countertops have been installed, telephones, HVAC system, and the HVAC system is working around the clock. Plumbing has been done. A comprehensive cleaning from the construction has been completed as well. And at least a certificate of occupancy is in place in order for us to take over possession to do the things we need to do. We need about 4 to 5 weeks. So from the time that the facility possession date hits that milestone, the vendor will need 4 to 5 weeks to be able to accomplish all of the IT equipment installs and staffing, onboarding, and hiring before go live. Penny, do you want to add anything else from the employer side?
Yeah, I would just, like I mentioned earlier, those internal meetings are key when it comes to the execution piece. Being able to keep folks apprised of what's going on and having them lean in when it's time for them to lean in for their particular area of expertise. And then something that we did, the ongoing communications. So we did weekly updates for our employees to kind of build the excitement, hey, we're building now, we're remodeling, and we did lots and lots of tours for leadership. So educating the entire senior leadership team, having supervisors come in different areas, the union come in to help build that excitement, and certainly don't neglect your middle management. We all know they're the key to communication and being able to speak directly to those employees and say, hey, we got something pretty cool going on over here. I'm excited for that to happen. So, don't forget about giving tours. Yeah,
I would say too, COVID definitely played a role in the last couple of years with implementations. There were shortages on supplies and glass and chips. So that impacted, from computers to other pieces of equipment that were needed in the healthcare environment. There were delays in construction because of just finding the manpower to do the work. Shortages in metal was another key issue dependent upon the services that were being provided. And so COVID definitely played a role also with the Great Resignation. And talent is, again, one of those long poles in the tent, but you add the Great Resignation on top of it. And so we really had to start early on and be in constant communication with our employers on, potentially offering, sign-on bonuses or extending what that salary amount is because of what we were dealing with the resignation and the competition out there as well. So those things are typically discussed and some of the risks that need to be planned for during the execute phase. So then we get to move to launch, which is go live. It's a very exciting time. All of the time and effort and engagement that all of these roles have played. I say those things instead of the blood, sweat, and tears, because it really is at the end of the day about the bandwidth, the time that you have, the effort that you put into it, and how actively engaged you are in the project. Is getting to this desired outcome. So lots of high fives that we're finally here, but there's also a ton of activity that's still taking place between the final punch list items from construction, allowing access to the employer's population. As Penny mentioned, the coordination of an execution of ribbon cuttings and open house and, making sure key leaders from the employer are engaged in promoting the services and are visibly there if possible to promote the services and the offering that's taking place. Typically during a launch or go live, we recommend a soft go live. And the reason a soft go live is important, what a soft go live means is that the schedule is within the health center is not fully open. So if the health center is open Monday through Friday from 8 to 5, we would put in some blocks during the day. And the reason that we do that is because we have new staff. We have new team members that are learning the premise health culture or the vendor's culture. And they're also learning the employer's culture. They're in someone else's space as well. And the employer's culture comes from a variety of various industries and isn't always the healthcare industry. And so they're managing two different cultures. And they're trying to get the lay of the land with the health center and all the services that are being provided. And we want this to be really successful right out of the gate. Both partners do. And so we encourage a soft go live so that everybody can get their swim legs, even from the employer side, from the amount of communications that are going to come in from members, utilizing the health center and feedback and experiences that they're going to share. And so being able to start out a couple of weeks with a soft go live has proven to be really successful. Penny, anything to add?
Yeah, I would echo that. We've done it both ways, and I would definitely recommend the soft go live. You can't, whether it's the healthcare team that you're hiring them from a traditional healthcare setting, and that's not what they're going to be providing, right? So they need time to learn and shift how they've been taught to provide healthcare, and then on the employer side, relative to the culture. I mean, you can't do a brain dump and sit in a room with the new on-site team and spend an hour trying to talk about your culture. It doesn't happen that way. Certainly you need to provide some key tidbits to them, but that's something that develops over time. And we all know the word of mouth travels quickly. And so you don't want to be not adequately, there's always going to be glitches, right? It doesn't matter how much time you spend trying to make sure they're all schooled up and implemented. There's just going to be hiccups. That's just the reality of any implementation. I don't care what project it is. So you want to make sure and try and minimize those the best that you can, because you want them to come into your on-site health center and have their socks knocked off and go back to their work area and say, wow, this pharmacist I just talked to, man, she is a fireball and she's going to save me X amount of dollars. Or I just went in because I had the sniffles and that doctor spent a half an hour with me and was asking me about all these other things. And I didn't even know that I might be diabetic, and they did some lab on me and so on and so forth. So yeah, definitely the soft launch is a good idea.
Yeah. And then we move into adapt. And this is really where the implementation team is starting to transition the on-site services to operations for ongoing management. So we typically have a 90-day timeline where that transition is happening between the IM and PM to operations. And it's really key because now the foundation has been created between vendor and employer. And hopefully, during typically the 6 to 9 month phase of an implementation project, where we're off to a great start with a strong foundation, and really can start developing and growing that relationship with the ongoing operations of the health center and services. Penny, anything else to add here?
So I think one of the questions that Larry had teed up for us when we were talking about this was, how do you prep your community for this, right? And so we've opened one on-site health center in the Dallas-Fort Worth area, and we didn't have to put forth much effort. It's a huge metropolitan area, right? So the fact that one of our business units was opening this up was just a blip on the radar that nobody was necessarily paying any attention to. Our most recent one was in Wichita, Kansas, which is a small community and actually has a very unique medical community. It's very competitive for the type of community it is. However, we're not the first ones to do this. So there were some other folks, some other employers in the area, a couple other employers who've done something similar. So it's kind of old news. So there again, we didn't have to put forth much effort. This is certainly something we've been talking about for several years. So we originally did have plans to go and speak in the community about it, but by the time the project evolved, we weren't the first ones in the water. So kind of those growing pains were taken care of for us.
Yeah. We've talked about a lot of these things throughout the previous slide on really what makes a successful implementation. You've got to have a solid plan and be able to execute on that plan. You need to make sure that all parties are consistently engaged. Just showing up for the calls and checking the box to say, yep, I'm here is not going to lead to a successful implementation. There's a lot of work that needs to be done, as Penny has alluded to, especially on the employer side as well. And so just making sure that folks are very much engaged throughout the project. Site readiness is huge. It's difficult for us to move forward and be ready for go live if the site isn't actually ready to go. So making sure that it meets the criterias in order for the vendor to be able to come into the space, that the health center staff is on board and fully staffed, that all the equipment and systems are working as they should. And that we are ready to go. Everyone's been oriented on the services that we're going to be providing in time for go live. And then the relationship, again, we've talked about that throughout our conversation today. Just making sure that there is, you can really not communicate enough. And be transparent in your communication. This is a significant lift. It's a significant investment. You've got two partners that are really focused on meeting a vision and their mission. For Premise, it's helping people get, stay, and be well. And typically for the employer, it's providing a healthier population, providing access to care, reducing the cost of care, increasing productivity. So there's a lot invested, and it's really important that you have a good, strong relationship, and it is founded at the implementation.
Yeah, I mean, certainly project management, site readiness is important, but from an employer's perspective, I'm going to tell you that relationship is paramount. Things are going to happen. Things aren't going to go right, no matter how good you are. I mean, there's just so many things that you have to pay attention to. You need a supplier who is going to be transparent with you, who is honest with you, who is going to own their mistakes, but ultimately help you drive towards a resolution, because there's no perfect plan. There's always some hiccups along the way. Anybody who's ever built a house, remodeled a house, watched HGTV, you know that things are going to happen. So you need a partner in this, a supplier who is going to be accessible to you. And like I said, is transparent, that you can have open, honest conversations with. It's a marriage, and this is a huge lift. And it's not going to be a short-term relationship. It's a long-term relationship. And if you're already struggling in the implementation phase with your supplier, you need to be prepared for perhaps a rocky road, because they should be on their best behavior at that time, really. So that's an indication of what your future relationship is going to be like if they're not truly going to be a partner with you, driving towards resolutions and solving any issues that come up.
Yeah. We talked about quite a bit of this too. This is just a call out on the time commitment. And again, how important these calls are that we have together to make sure we're up to speed on the various activities that are taking place, who's responsible for what and when, when's it due, how are we going to get it done? And so I would say on average, just the calls and the cadence of the amount of calls that happen between, vendor and employer is about 4 to 8 hours a week. And that's dependent upon, the number of ad hoc or work stream meetings that also need to take place on the side. There's the weekly internal call, as Penny mentioned. That's really kind of a best practice to have that on the employer side as well, but also the weekly external call where we're bringing the vendor and those key roles together along with the external key roles to facilities. And construction call is a weekly call, and that is a very important call to attend because that is another project in and of itself. And then of course the work streams too. And then key resources we've talked through as well. And Penny, is there anything else you'd like to add?
Yeah, I just, from my seat in the ballpark, I'd say it's like a co-lead on it. You spend quite a bit of your day every day on it. So certainly what Leah was talking about with, 48 hours a week, you've got a lot of stuff that you have to do internally. Both projects that we were involved in, I have a healthcare background and the other leads had a healthcare background. It's complicated. And it was complicated for us, and we had to be educated a lot on many of these aspects. I could talk for the next hour on fair market value, and it's stuff I never even wanted to know about it. So I would encourage you that if you don't have somebody with a healthcare background, to seriously look at employing a consultant to help you with this. It's not something that you do every day. And when I add up the amount of time that I had to spend educating myself and tapping into Primis to educate me on all of this, as well as outside folks, when you add up the amount of time spent, it's probably worth the investment that you make in a consultant. And that again speaks to the partnership that you have. So again, Primis is great about educating you along the way, providing you with the information. And, you sit there and you listen to it and you go explain it to the powers that be. And, those attorneys ask funny questions, or the finance person asks funny questions. And you think, God, I thought I really understood this, but I guess I don't. So I'd run back to Primis and I'd say, okay, school me up here. Okay, what are my talking points on this? So that again speaks to the value of the relationship that you have with your supplier.
And Penny, you were also really good about inviting us to the conversation as well to help support whatever the item is that's needing to drive to a decision. So being able to lean on your vendor because they do know what they're talking about, and they are in this space, and they are the subject matter experts. You've done a great job doing that as well.
Yeah, absolutely. Better to hear it from the horse's mouth than me trying to be a parrot. So
that's right. This is just to quickly show. This is an example of a timeline. And you can see the first 4 things are those long poles in the tents we've talked about: construction, talent acquisition, data install, benefit plan design, revenue cycle management is another piece. So this is just an example of that. And at the bottom, if you look at facility turnover to Primis Health, again, this is in business days, so it's about 4 to 5 weeks. That's critical because critical things are happening during that facility turnover. The equipment install, getting the health center ready to go, and also very important, the staff orientation and training is taking place. And then finally, we've talked about these things really kind of throughout, but these are some lessons learned throughout implementations that have been done. And I know, Penny, you've experienced these things as well. And, I don't know if you want to just kind of speak for just a couple of minutes on kind of some of the aha moments that you've had through especially this last implementation.
Yeah, so probably our largest pain point was the alignment of the benefit plan design. And again, that comes back to your company structure and who's in control of that and how many parties you have to get on board with what it is that you're choosing to do. Yeah, that was certainly a long pole in the tent for us, was determining the fair market value and getting everybody aligned on the risks that we were choosing to take or not necessarily take. It just depends upon your appetite for that, kind of like investing in your 401k, right? And then making the decisions quickly, having people who are empowered to make those decisions, because if you're waiting around for somebody at a senior level to make those decisions, it can be a challenge.
So yeah, I think that we're always learning lessons, and it's an experience. Each implementation is extremely customizable. We do have the saying that once you've seen one on-site center, you've seen one, and that really starts at the implementation, because we're customizing a project plan based on the needs for that specific employer and or population. And so we're always taking those lessons learned and the feedback that we're receiving. And again, the experience that we're all going through and applying that to better the next implementation. Larry, I will turn it back over to you.
Great. Thank you all very much. We are past the hour. We're going to stay on for a little bit because we have a lot of people who are interested. I'll just take some questions and call on some people. So one question was, when establishing a budget with an employer, does this include the establishment of a clinic formulary for pharmacy services? Does the budget allow for additions to the formulary based on the health and demographics of that population?
Sure. Yes. Depending on the type of pharmacy, there's certainly a work stream of a conversation that takes place of what we feel like based on the information that the employer is willing to share. If they're willing to share pharmacy claims information, we can provide what that formulary looks like. And then there's certainly a conversation of if there needs to be an adjustment with that.
Great, thank you. All right, now I'm not going to ask on for certain individuals. Justin Seaman, Justin, do you have any questions or comments?
Nothing for me.
Okay. Jessica Harden, any comments or questions? Okay. Kim Nugent, Kim, any comments or questions?
No, I think this was great information. I appreciate all of the insight into this implementations and everything that you've learned. Is great information. Appreciate it.
Thank you. Leanne Henderson, Leanne, any comments or questions? Okay. Aaron Tarter, Ellen, any comments or questions, Aaron? Olivia Jansen, any comments or questions, Olivia?
Nope, I'm all good. Thank you.
Okay. Sarah King, any comments or questions, Sarah? Okay. And Glenn, any comments or questions?
No, thanks, Larry. I appreciate it. That was very helpful, and Penny and Leo's information was very valuable. Thank you.
Okay. I don't see any other, well, hold on. There's one other question here, I believe. Oh, I'm sorry. Aaron Tater, can you want to have a question? Aaron, can you hear us? Okay. Go ahead, Aaron. You should be off mute. Aaron?
There we go. Sorry about that.
Okay.
So I did have one question. Employers have often set aside space in a new building or a meeting, or a building that is about to begin, being completely remodeled for a clinic, well in advance of selecting a vendor partner. This is applicable for employers who don't have an existing clinic supplier relationship. I was kind of curious. I've seen what some of the other suppliers out there can do, but what kind of design and construction management support is available from Premise for prospective employer clients, either as a separate SOW or, how have you handled that in the past?
Yeah, I think that's a great question and something we come up against quite often. And even in Penny's last implementation, this is something that she experienced where she had space, not healthcare space, but had space that they were able to utilize for the health center. And so conversations actually took place, gosh, Penny, pre-COVID, with engaging our full-time architect that we have on staff within implementations, gave the parameters, the square footage, gave a layout of the space. And from there, based on the services that they wanted to provide, starting out to their population, our architect, Doug, was able to start building out what that design looks like. And there's lots of back and forth discussions to get down to the details and for, the team to be aligned with what it looks like. And Penny, I know, got several involved, and even their local architect. And Penny, I don't know if you want to add any other color to that, but there's certainly quite a bit of support from at least the Premise side on what we can provide when you've got space, but it needs to be designed out.
Yes, definitely. So even from, the site assessment, like Leah had mentioned earlier on, we selected the space, but Premise physically came and looked at it. Their architect physically came and looked at it and, said, yeah, I think this will work. We talked through things a little bit. They certainly provide the original design. We selected an architect, which I would advise, that has experience building medical clinics. And so they worked very intimately together and participated in the weekly construction calls. If anything came up, they were able to bounce ideas off each other. Ultimately, it's the employer's decision because we've got the checkbook, right? And then also it's our clinic, but we leaned very heavily on Premises experience and recommendations for how everything was to be designed.
But what about where, that's really helpful, thank you. But what about where there is no actual contractual relationship yet with Premise because the client, because you're just starting to evaluate the marketplace and potential vendors? Will you do kind of a separate Schedule A or SOW or whatever for just that design work?
Typically we are in conversation with a potential client that is thinking about maybe even going out for RFP,
Right.
and they're trying to decide that, but they want to know, okay, the space that we have, is it even doable before we even go that route? And there's certainly support that's provided. We do have a cost if that is the only service that is needing to be provided. But typically it evolves into further conversations, even if the employer's going out for formal RFP and we're participating in that RFP. That's just some of the due diligence that we do in establishing and creating a partnership.
Okay, thank you.
Yeah, and I would say that I've found Premise to be very generous with their time on that due diligence side, and which speaks to the type of relationship that they like to build. So I would lump that in that relationship category. It's kind of like, attorneys that you work with. I have attorneys that we work with on various things, and you don't want an attorney that's going to nickel and dime you every time you place a 5-minute phone call to them. They see the bigger picture, that if they take those 5-minute phone calls and don't bill you for it, that they're going to eventually get that business.
Mhm.
We have one final question, and this is for you, Penny. Many employers like to see the center ultimately as being the hub of all their benefit programs. Do you recommend reaching out to all your other contracted vendors for smoking cessation, disease management, EAP, wellness, obesity, to have them connect to the center's EMR or to meet with the vendor? Or how do you look at integrating all your benefits so you get the biggest bang for an integrated approach to healthcare?
Yeah, absolutely. And that is part of Textron's culture anyhow with our benefits. We expect all of our vendors to work together. And so that's part of, getting the on-site team schooled up. We talk to them about our benefits. We pull them into, our well-being program and educate them what we have with well-being. We even provide them with our well-being calendar on this is a theme we're going to talk about this month so that they can help promote those services. Our clinic that we just opened up actually has behavioral health in it. We have made them a part of our employee assistance program and have conducted an orientation with our EAP with them. So absolutely, we do spend a lot of time, and I think that's an essential element to the success of your system. Like I mentioned earlier, healthcare is very complicated. And so the more people who know about all of the resources that are available to your employees and are able to speak to it and help guide them and navigate them to who's the best resource for this particular issue, it's all the better for your employees.
Yeah, and
Thank you.
we actually encourage to do vendor summits. We encourage it during implementation. However, there's a lot of activities that are going on, and that is a lift to plan for that vendor summit where all of your health and welfare partners are coming together and understanding how they can utilize each other and get to know each other. So it usually happens between 6 months to a year after go live, when some of the implementation has settled a little bit. But strongly encourage vendor summits and to happen on an ongoing basis.
Great. Thank you all for participating, and especially Penny Gilbert and Leah Kathy from Premise for taking the time to put this all together and out of their days. A recording of this will be posted on the website for all NAWHC members. And if you want more information about this topic, you can contact any one of us. And we'll be glad to help you out. So again, thank you very much. We hope to see you at a future program. Everybody have a safe and enjoyable day. Bye-bye.
Thank you.
Thank you.